The Bros just moved to Connecticut. The family of 7 is still unpacking after moving from Georgia. One of the first orders of business, securing childcare.
Waitlist, waitlist, waitlist.
Of the 5 kids, one of them is a toddler, but the process of finding care in Connecticut wasn't easy.
And they'll say, our waitlist looks right now about 9 to 12 months. Maybe by March we'll have an opening for you. But I'm like, I need an opening today.
The Bros are not alone. In fact, for many American families, the story sounds too familiar.
Infant toddler is a childcare desert across the whole state.
Alex Schiavone is the executive director for Friends Center for Children, a program that serves 122 families in New Haven. But she also serves as the co-chair of Childcare for Connecticut's Future Coalition, so she knows the industry well.
So we were in crisis prior to the pandemic, but we were functioning. It's hard to even say functioning. We were operating because we believe in it. We know what's best for children.
One national analysis estimates some 70,000 childcare programs in the U.S. are at risk of closing. The same study estimates 917 programs could close in Connecticut, affecting 37,000 Connecticut children, leaving many parents scrambling to find care.
And we've got people who are now going to be facing either trying to find something that isn't the best fit for their child or is exorbitantly more expensive, or they stay home.
The average price of childcare in our state, about $15,000 a year. By comparison, in-state tuition at UConn, not including room or textbooks, is just over $16,000.
Tuition-based programs have raised their tuition almost 30% in the last 3 years. There's a limit to what parents can afford to pay.
Price-wise, I have a 13-year-old. It's definitely doubled. It used to be like $110 a week.
Mm-mm.
No.
Oh yeah, no.
You're not going to find that anywhere.
No.
So why is childcare so expensive right now, and why is the industry in crisis? I heard the same answer over and over: staffing.
Here we go, here we go, here we go.
A Connecticut Early Childhood Alliance report found this year there are 3,800 open early childhood jobs in our state. About 70% of child care centers say they're understaffed, which means centers can't accept more children. If they can't accept more children, centers are missing out on precious tuition money to keep the centers up and running.
We can't find educators who are willing to make $5 less than they would if they went to Amazon or Target. And nor should we.
The average salary for a full-time early childhood educator with a degree is $34,500. These teachers, predominantly women, are barely making more than minimum wage. Advocates are in agreement: when you can't find staff, classrooms close.
Typically the smaller ones that service areas that are already in dire need of care, those are going to be closing or cutting back.
When classrooms close, fewer moms and dads can find childcare, forcing them to make tough decisions about who's working and who's staying home. Schiavone says this means a lot of pressure falls on the childcare industry and its workers to allow parents to get back in the workforce.
Should not expect them and to be willing to work for poverty level wages to support and subsidize the entire Connecticut economy. If we're going to raise wages, we have to then charge parents more, or we have to get subsidies from the state or federal government.
Can we use our hands to pick it up?
Connecticut has the Care for Kids program that does just that. But advocates say the wait list is long, and the threshold for who qualifies squeezes out a whole group of parents who make too much on paper, but not enough to comfortably afford care.
Where we ask parents when they have the least wealth to spend a huge amount of money. It just doesn't make sense.
As for the Bros, they found an at-home daycare, and they're excited for their daughter to start soon. The challenges they've had along the way have inspired them to look into opening a daycare of their own.
I'm passionate about the child care thing, and I feel like I need to do something.
Connecticut does have some programs in place, like Care for Kids I mentioned. The state also has an Office of Early Childhood. Now, some states don't have departments like this. Also, just this year, Governor Ned Lamont signed an executive order instructing the Connecticut Office of Early Childhood to come up with a 5-year plan to address the industry challenges. It's called the Blue Ribbon Panel. The panel has been hosting listening sessions and their reports expected in December. In the meantime, if you're a parent struggling to find care or afford care, definitely look into Care for Kids. You may qualify. Also, see if your employer offers a dependent care FSA. To hear more of my conversations with some of these industry experts, including Representative Mary Wielander, visit fox61.com and look for this story.